They've talked about it for more than a year, but now the country's 9 governments have finally signed up to a new hospital funding deal. The Prime Minister's calling it the biggest change since Medicare. It'll deliver more than $100 billion in extra federal funding over the next 2 decades. But to clinch the deal, Julia Gillard's had to give up some key demands that her predecessor Kevin Rudd fought for. Chief Political Correspondent Mark Simkin reports from Canberra.
Herding premiers and chief ministers is never easy.
Very demanding, aren't they? How do you keep them in order?
You don't even try.
But after 15 months of consultation and compromise, all the states and territories have finally signed up.
This agreement delivers the most fundamental change to healthcare in this country since Medicare.
It's not the first time a Prime Minister's declared that recently.
Well, today we've reached an historic agreement to deliver better health and better hospitals for the working families of Australia.
So we've walked into that room with no national health agreement, and we've walked out with a national health agreement. This is signed, this is done, and it's agreed to by all states and territories. We've never been in a position to say that to you before.
The latest agreement is less ambitious than the one Kevin Rudd championed. That's dead and buried. The states no longer have to hand back some of their GST. So instead of being the majority funder, the Commonwealth will meet half future cost increases. A guarantee elective surgery patients will be treated within a reasonable time is now a target. And rather than having to see 95% of emergency patients within 4 hours, hospitals must see 90%.
Julia Gillard has capitulated to the demands of the states. The so-called great negotiator once again has given everything away and received nothing in return.
Not really. The guts of the old agreement are still there. Nationally set prices for hospital procedures, a single funding pool and buckets of cash. Over the next 2 decades, the Commonwealth will inject $175 billion into the system.
Well, it'll take a few years for these changes to take place, but I think patients will see a difference.
The government insists it's a coincidence the new plan was announced as the architect of the old one was in a hospital himself. Privately, though, senior sources think Kevin Rudd promised too much and his plan needed a dose of pragmatism. Mark Simkin, ABC News, Canberra.